All right, thank you very much. So just to summarize very briefly, there's been a lot of data collected. There's been a lot of priorities emphasized. Individuals that represent different organizations, communities, nonprofits have integrated into this. There's some broad brush strokes kind of that we're looking at here that can really affect change. And so our job here is to prioritize those. So your first thing is a test. What's the difference between a chip and a chaw and a map? I'm just kidding. Okay, I'm trying to keep you awake there. But so the first one of those 7 priorities I want to take a few minutes to talk about is maternal and child health. And so we know that the United States fares pretty poorly in maternal and child health outcomes, despite the fact that we spend quite a bit of money on healthcare. Okay, much more than many other countries that have many better outcomes than that. And infant mortality, we're ranked 27th. It's a little bit older data, 2008. Sometimes these surveys don't come out, but every 4, 5, 6, 7 years. And likewise, we have preterm births rates that are quite high. 1 in 9 births in 2012 were preterm. And there's an extensive amount of cost associated with having premature births, with hospital stays and time spent, medications, and a lot of the intense time that's spent on these children to make sure that they make it and become healthy. So in Clark County, we know that about 70% of the women receive early and adequate prenatal care. There's some targets through kind of the Healthy People 2020 objectives, which we often use as our guidelines. They would like to see us at 77. I think I'd like to see that at 100. I think that's true for all these in maternal and child health. But these are just some of the realistic benchmarks that we're trying to reach with respect to these outcomes. 91% of women abstain from smoking during pregnancy. It also would love to see 100 there. I don't think that's an unreasonable thing, but 98 is the target. And again, about 14% of the births between 2006 and 2012 were those preterm births, and we can do better in all of these areas through prenatal care, management, and education, a lot of interventions that we have. Okay? Some of the consequences of poor maternal and child health are pretty obvious to most of us. We don't need to dive into these too deeply, but cognitive impairment, disabilities, long-term delays, premature mortality. There's relationships now to poor early life and later chronic diseases that are now being linked to poor early outcomes. The economic burden, both short-term, medical, days of missed school, days of missed work, test scores, grades. I mean, it goes on and on and on and on, that we have to correct these things as early as possible, or we will pay the price later, either financially, economically, educationally, advancement, or income. We do have a few things that you'll see are themes throughout this, and one of the themes that you'll see, I think, in all of these areas is health disparities. So you're not going to see a specific slide that discusses health disparities, but we can highlight a few of these under each of the specific categories. One of these is teen pregnancy prevention. We know that we have lots of teens getting pregnant. Here in Nevada, one of the higher rates across the nation. That's a problem for us. And basically only about 50% of those teens that get pregnant are receiving any prenatal care, which is obviously an issue, going back to the other sides. And only about 38% of those actually go on to finish high school once they do become pregnant, which is a horribly, horribly low number. And we know that's related to other many significant reduced outcomes. We also know that blacks are more impacted by some of these things. Their children have consistently higher rates of low birth weight and experience more preterm birth than some other of our ethnic groups, especially Hispanic and white. So those are just some of the highlights for that, and you'll notice that as you go around the room for each one of these 7 criteria areas, there's some additional data. There's additional data in your packets that you can read and evaluate kind of the scope and magnitude of issues that we have surrounding each of these individual 7 areas. Because remember, at the end, you're going to have to try and kind of rank them and say which ones do we think are the most important, where can we make a difference, who impacts the most people, so on and so forth. All right.